Oh, Rita Espinosa?
You know, some of the
Okay.
court members,
Rita Espinosa?
I don't know about the new ones, but
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
yes,
Check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and I'd like to welcome, joining us today is Rita Espinosa, who is the Chief of Epidemiology for San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. Today we're reporting 299 new cases of COVID-19 in our community, which brings our total to 34,932 since the pandemic began. We also, unfortunately, have, again, 15 new deaths to report tonight, which brings our total to 313. They are as follows: 5 Hispanic males, including 2 in their 40s, the others in their 60s, 70s, and 80s, 3 white males in their 50s, 70s, and 80s, and 2 Hispanic females in their 50s and 70s. We have 1 white female in her 70s and 2 males and 2 females of unknown ethnicity in their 60s and 70s. Again, we continue to mourn the loss of these vital members of our community, so please keep them, their friends, and their family in your prayers this evening. Tonight, we're also reporting 1,059 people in the hospital with COVID-19. That's down again, 15 patients down tonight, with 430 in the ICU, down 7 from yesterday, and 294 on ventilators, which is up 8 from yesterday. As far as capacity in our hospitals, we have 44% of ventilators available and 11% of staffed hospital beds available, and our hospital system remains under severe stress. In terms of total percentage of admissions for COVID-19, it's now at 30% in our hospitals. Let me turn it over to Judge Wolff.
Thank you. Well, at least there's a continuing improvement in terms of people in the hospital. We're now 208 beds down from where we were at a high point when it was about 1,267. So that's a hopeful sign. I think you'll get a weekly update, as was published yesterday or today, I guess. Some 21,000 people have recovered. We'll see what that a weekly update brings us on Monday and give us an idea of how many people have recovered and gone. It looks like the momentum toward face mask is really picking up. There was a state survey, a nation survey that showed 3 out of 4 people support the mandated face mask. 89% Democrats, 58% Republican. But most important of all, they're actually doing it, whether they support a mandate or not. 95 Democrats, 75% Republicans are wearing the face mask. There's also another interesting evolution that's occurred in terms of public opinion. There never was given much consideration to large gatherings. As we've learned more about how dangerous those large gatherings are, people are beginning to understand that they shouldn't be going to those. Some 66% of the people are really concerned about large gatherings, and 89% say they're not going to one. So I would be extremely careful about that, and I would certainly not go unless you take all the necessary precautions if you're going to be around one that is authorized that you could go to. We are getting prepared in case this, I think it's up to a level 1 hurricane now that's coming into the Corpus Christi area. Nim Kidd was with the mayor and I this morning, who's the head of the statewide emergency offices for the governor. And we started talking about that a little bit today. And it's probably going to have to be handled, well, it will be handled a bit different than I think we have in the past. Because as you well know, there's an outbreak of COVID very seriously down in the Corpus Christi area. So some of the people coming up here, if they do come up here, could very well have COVID. So I think what they're trying to set up right now and make it work out is where we'd have a central check-in. I think the San Antonio Fire Department is going to be taking a lead out the Coliseum, just like we did on the testing, and then be able to go to hotel rooms rather than trying to house. I can remember when we had a Hurricane Rita, and then we had, thousands of people out at the bases, and even when we've done setups at the Coliseum, we've had as many as 500 first responders there. So this time I think we're going to have to do it different and try to make rooms available so that we don't spread the COVID on top of the issues we've got already.
Thank you, Judge. And it's a good reminder also that the work that we do now together with regard to stopping the spread of coronavirus will show up around the time that people want to be getting back to school. So if we have interest in getting things back on track for the fall, we really have to buckle down now. Do not let your guard down. Continue to practice physical distancing. Certainly wear your mask if you're outside of the home, and stay home as much as possible. And certainly if you are sick, stay home. I know many of you are getting toward the end of some benefits provided by the federal government. We do want to remind you, if you're in need of rental assistance, please contact 311. We have a city and county program in place to help with emergency rent relief and other assistance that may be needed. You can also go and get more information on it and all updates on COVID-19 at covid19.sanantonio.gov. And as always, you can also text COSAGov to 55000. Rita, as well as myself and Judge Wolff, are now available for questions.
Mayor, have you had any conversations with leadership in Corpus Christi? Are y'all anticipating anybody to come up here to potentially leave Corpus for shelter?
I talked to Mayor McCombs late last week, and it was very tentative. Again, they're dealing with surges in their own hospitals right now, so obviously the concerns are amplified with the fact that there might be some weather. But as the judge stated, we are prepared. We've got several hotels coordinated in the event that we need to relieve evacuees. But we are in the danger zone in so many ways with regard to the storm and the threat of increased transmission if we were to have a lot of activity coming here. So we're asking everybody to be on guard.
And we're also seeing, some issues out in the less populated areas, I guess you would say, and then along some of the border towns like Val Verde and then up in Uvalde and Fort Duncan, where they're having a pretty serious uptick in people in hospitals, and so that could put an additional strain on us also.
Would those hotels also be open to the general public, or would they just be reserved for hurricane evacuees?
So we have separate isolation facilities available. Again, if people need to isolate themselves from family members because they're positive with COVID-19, they can again call 311 and be walked through that process. We have those available, but there's additional facilities now being coordinated in the event we need to evacuate people for that hurricane. I don't know if you want to talk any more about the isolation facilities we have available, Rita, but that continues on.
Right, we still have those facilities available, and those are specific for individuals who have tested positive for COVID and don't have another location to where they can isolate away from other family members. And I believe we also have individuals that, if they've been exposed and cannot quarantine, then those locations can be used for those individuals as well.
Could you maybe paint us a picture of the challenges this go around and the difference of being prepared for this type of event with COVID?
Talking about with the hurricane, potentially with weather. I mean, I think you can throw the whole playbook out the window. You know, with a normal evacuation, you're trying to pull as many people as quickly as possible in roughly the same space. And you see pictures of what Freeman used to look like with Hurricane Harvey. That can't be the way we do it now because there would be so much risk of transmission. So, you know, we had our meeting with Eric Epley and the folks in the Emergency Operations Center this afternoon. They're well aware of that. We've been again doing tabletop exercises, and we'll be dealing with this probably for the rest of the hurricane season.
I'd like to pivot over to the schools really quickly here. The CDC had released some new guidelines about safely reopening schools this fall. Obviously, we know that distance learning is planning to continue until sometime in September, but have you guys had a chance to read those guidelines, and what is the reaction to that?
I reviewed the guidance. You know, I'll just speak from my perspective. You know, the tone changed a little bit, but the substance didn't much at all. If you look at the CDC guidance on opening schools, it still says if there's substantial uncontrolled transmission, that we need to be prepared to close schools. And that's exactly where we're in right now. Unfortunately, the new CDC guidance doesn't consider the fact that schools are already closed and we have uncontrolled transmission. So I think if you look at it as a whole, it's telling us what we already knew, which is that we've got to be very careful. We've got to have procedures in place to isolate people who do end up getting infected. But before we can even start in-person schooling, according to CDC and our local public health authority, we need to have transmission well under control, and that's not where we are yet.
And if we do get it under control, they still have to have a plan of how they're going to operate. And I think that's being submitted to Metro Health now. We're just reading Southwest School District's plan that they've got in place that they're submitting to you if indeed we get to the point that they do open on September the 7th.
Right, and we do have a work group who's working on the school policies. They're actually scheduled to meet the first week of August to discuss like different thresholds and what indicators would be used to know when is it safe to open or close the schools based on what's happening in our community. So they are working towards that to identify what are the different measures they need to be looking at with the transmission in the community and what's occurring to be able to reopen schools safely and put in the measures to protect the children and the staff.
Clearly, there's some trepidation coming from families, faculty, and staff. Have any conversations been had directly, Mayor or Judge, with teachers from school districts here, or school districts in our area?
Yes, and actually Rita can probably speak to that best because they were part of that whole task force to lead to the order that you saw from Dr. Wu.
Right, they are part of the task force. So we have teachers, we have parents, we have school nurses, we have physicians, all part of that group who are discussing and coming together to make these decisions so that we are getting input from even families to make sure that we're making the right decisions and trying to take every possibility into consideration.
Mayor and Judge, with the continued, although the number of the cases were low today, though with the jump in caseload, the rise in the death toll that we've been seeing, Judge, it seems like what's giving you hope are the hospital numbers. Is there anything right now that is giving you hope and where we're at right now?
Well, I mean, the fact that we have 200 less people in the hospital, that certainly is a step forward. The other numbers are just so hard to make a lot of sense out of. We only had 200 some odd cases yesterday as opposed to 1,000 the day before. Those numbers have jumped all over. And we don't know how old some of those cases are. We don't know if they're 3 days or 4 days or 5 days or even longer. So it's hard to know, to make sense out of them. Now, with respect to the deaths, there's 15 today, and there were 15 yesterday. I hate to say it, but I think we're going to see more of that. All you have to do is look at the numbers of 430 in ICU and 331 of them on ventilators. And then we don't know for sure what will happen in some of the nursing homes. As you know, there's a lot of people that are positive in nursing homes, and we can probably expect some to occur there also. So regardless of whether we're getting control of things now or not, and there is some evidence we are, you're going to still see more deaths occur in the next several days, I think.
I would echo everything that the judge said. Also, what gives me hope is I was able to go to tour the Alamo Dome, where we've got hundreds of people over there doing contact investigations, doing filing of paper. It is remarkable just how complex the job of managing this pandemic is from the standpoint of those volunteers and the staff members of Metro Health and the folks at the county. We have to receive faxes from private providers to figure out who's positive and negative and input that into a system to start tracking people. There's so many different ways that data is coming into San Antonio Metro Health from thousands of different sources, and they have to somehow make sense of this all into a report like this. And to see their operation moving, and to see the esteem that they have for the work that they're doing is very hopeful to me. If you're just watching these numbers and seeing the level of illness and death that's occurring, it's concerning and almost discouraging sometimes to see all these things pile up. But when you see the army of people that are working to get a handle on it in our community, it is really inspiring. And I just want to say thank you to all the folks with Rita who are working over there at Metro Health in the Alamo Dome right now.
Consistently we are seeing those hospitalization numbers going down, which is a good thing. It's a good trend to be seen. But is there an idea of why that's happening? Have we figured out if that's because there's more recoveries or unfortunately more deaths?
I don't know. Maybe Rita may have a better idea of that.
Honestly, it's probably a combination. It's a combination of individuals getting better. It's a combination of individuals not getting better and maybe being transferred over to long-term acute care facilities. So then they're opening those hospital beds. And then, unfortunately, it is some individuals that have deceased from their illness, and thereby other beds are being open and available. So really, the measure to look at is more of what's coming in and how many new hospital admissions you're having to really look at where are we going with the disease.
And to your point, this is not the time to let down your guard because hospitals are still getting cases.
We still have a lot of infection in our community, so individuals still have to take as many precautions as they can to protect themselves and their family members.
Yeah, and keep in mind, we were reeling in late June and early July based on the activity that we knew happened and the epi curve that pointed back to Memorial Day. So today is, I lose track of time sometimes, July 24th. If people are interested in what life will look like and want a bit of normalcy by the end of August, we got to really buckle down now and work hard together to stop the spread of this virus.
And speaking of just taking precautions, we know that youth sport organizations, some have been practicing or possibly preparing for their upcoming seasons. Have any conversations been had with organizations about canceling practices or sitting out their seasons?
I'm sorry, you're going to have to repeat all of that again. I apologize.
As far as taking the precautions with youth sports organizations, have there been any conversations had with organizations about sitting out their seasons or canceling practices?
We've been candid about this, and unfortunately there's not any easy answers, but it is clear that it is not a time right now to be conducting youth sport activities. There's too much transmission going on, and as far as the school sports, the director from Dr. Wu applies to that as well. So, good things will come, but we have to work hard to get there. And, unfortunately, some of this stuff is things that we don't want to hear, but it's what we have to do to protect people's health.
Up to what, 11% or more of young people 17 years or younger that are coming down with COVID. So, being out there close to each other on a sporting field is probably going to lead more spread.
We have a text question from Vladimir Telemundo regarding the length of time it takes for post-mortem COVID test results to be delivered. And he's referring to the situation with the family of an undocumented resident who was found deceased 2 weeks ago on the south side of the county, has been told they have to wait at least 8 weeks for a medical examiner to get the COVID test results. They want to send her remains back, but they can't until they get the results. Can the process be accelerated?
I think that has to do with the medical examiner's policies on whether the case has been closed or not. Not necessarily that it takes that long to get the COVID results. It doesn't take that long for them to do the COVID testing and get results at the medical examiner's office, but I think the length of time to transfer the body has more to do with closing the case out from the medical examiner's perspective. But that's just based on what I know, not definitively.
On that same topic, are we continuing to track that number, the postmortem COVID testing?
Yes, we are continuing to track that.
Updated number by chance on that?
I believe today it was 28, that we're up to 28 deaths through that we count and that we report out from the medical examiner's office. There are other deaths from the medical examiner's office, but if they were previously reported to us or they're not in our jurisdiction, then those don't get counted as reported by the Bexar County medical examiners.
And that 28 is from when? Is that the total number right now so far?
28 so far, yes.
From when we started doing this testing?
Yes.
Mayor, Judge, we do have an organization, Texas Youth Football and Cheer, which is a fairly large organization that says that they'd be willing to sit down and have a conversation about practices and the season. Have you guys had any actual conversations with that organization, or would you be willing to about concerns?
Sure. I haven't had any conversations with them, but would welcome any conversation with our health officials I appreciate the willingness to do that.
Absolutely. I don't believe we've been contacted by them either, but we would be open to having discussions with them.
I'd like to also ask, just really quick, we know the effects that COVID-19 has on our respiratory system, but have there been any studies done on how it affects other parts of our bodies, particularly our hearts?
There's a lot of research being done. I don't think that we can say there's something definitively yet, but it's still something that's being investigated. There had been some, there's some that think that yes, it is affecting the heart in some individuals, but I couldn't tell you what the research is definitively on that at this time.
I'm going to shift real fast back to the emergency weather prep. What do the tabletop exercises look like for that? Does it just involve looking at a variety of scenarios?
And we really need to have Chief Hood or Eric Epley or Chief Pat Cepeda, who's our Chief of Emergency Operations Center, come in and talk about that. But it is about contingency planning and making sure that we have all the resources of the state and the city and the county working together, from law enforcement to code enforcement to all of our human resources in our health department.
We have to put them in. Hotels, I believe we can get up to 75% reimbursement from FEMA. I believe the state will help us on that balance of that 25. We may have to chip in some, but the funding should be there if we have to use hotels.
Going back to hospitalizations, I wanted to, we touched on it a bit already, but I wanted to go back and ask to get a little more context. In June, we were seeing anywhere between 50 to 70 people added to the hospital every day. Now it's starting to decrease. Today was a decrease of 15. Yesterday was a decrease of about 30 or 40. With the people that are leaving the hospital, either being discharged, being sent to other facilities, or unfortunately passing, are we seeing still a high number of new admissions to kind of like either offset that? Because, people at this point, people that went in there in June, they're probably getting discharged at this point. Then there are new people who are taking their space. Are we still seeing a high number of new admissions going in?
I don't have that number to say how many are the new admissions at this point. That's something that we would have to look at, hospital admission dates, and that's some of the data that we look at on a weekly basis. So we'll have to look and see if we can have that for you maybe next week or in the next couple of weeks.
The mayor's been pressing.
It is a hard, it's a hard
Mayor's
number.
been pressing on that every day, and I mean, sometimes a person will be in the hospital, I understand, that he may develop COVID, and so maybe he wasn't admitted for that. I don't know, but we don't.
One thing, so I've been after this number for a while, and it is complicated to get to it from the entire STRAC system. But one thing that I will just tell you is personally frustrating is that the way we count data is not uniform in the state or across the country. So I know there are some communities that are tracking new admissions, but when you look down into the data, it's actually net difference from day to day in terms of hospitals. So what we show, we are tracking the total number of admissions, or excuse me, the total number of patients, and we're watching that net difference. But I am after that new admissions data and hope we can get some uniformity in there from our STRAC data soon.
You're correct in what you were saying. I think on June the 7th we had 107, and it just seemed like it was going to 200, 260, 300, 400, 500, 600, 700, 800, and eventually up to 1267. So they were plowing on every day. So this little turnaround here, it's really not long enough to know for sure whether we are making some good headway, but it's a hopeful sign.
The chart we had at Texas Public Radio showed that it was basically a vertical jump when we got into mid-June, and then it started looking like it was going to plateau off. Now it looks like it's decreasing, and I believe a couple of days ago, or yesterday maybe, you showed a chart that showed what hospitalizations could look like as we get into August. So it looks like we're at this plateau point, and if things keep up, it would the hope is I'm guessing the hope is that we start trending downward?
Yeah.
That's the hope, but keep in mind, again, it requires us to be vigilant. When we were back in April, when we were watching the rise, and it looked like a big steep hill, that y-axis was just through April. But if you look back at what April looks like from this perspective now, there was nothing happening. So we're at a place right now where we're tapping close to 100% capacity. We got to be very careful with that. We have to also bring it down because it could get worse if we're not careful.
And it takes a long time to have any impact. When you look back at these numbers, I think it was June 22nd when the mayor and I did the business thing, and that took a while to get up and going. The governor came along on July the 3rd and did his face mask, but you take an action and you don't really see any impact on that action for 3-4 weeks or maybe even longer. All we're doing now is hoping that people are being more careful, and it's up to everybody individually to do that. Whether it's the face mask, social distancing, sanitation, stay away from large crowds. The more people do that, then we are going to bring it down, but it takes a good while to see that, and we're still not at the point that we can tell you that we are winning.
One last question on my end. I don't know if the three of you have heard of this. I'm just curious, but today I talked to a medical expert at a hospital here who is saying that a lot more people are dying at home or waiting too late to call 911 and return are getting really, really sick. The common denominator is the fear of going to the hospital. Is this a trend that the three of you have heard about from leaders here? And just curious what your take, just hearing that, because it is disturbing given the population, the health-wise of San Antonio.
Well, you gave a number out a minute ago. 28 were and those were people that died at home or died somewhere else, right?
Those are individuals that have died at home. Some of them had sought medical care previously, but were not hospitalized. Some may have been hospitalized and then discharged and then deteriorated at home. We have seen, I cannot tell you definitively how many, but we have seen some cases where in the notes it is written that the individual did not seek medical care. We don't know why. We cannot say necessarily. It would be more anecdotal information, or we'd have to look into it a little bit further to find out exactly why individuals are not going. Sometimes individuals may be sitting at home waiting for their results, and then they're getting worse on their symptoms. And if they don't have a health system already or a healthcare system for them to go to access, some may just not follow through and go to the emergency room to seek that care. So I think it's a combination of all of it. But we'd have to look into it further, and of course that's talking to families who've lost a loved one. So it would be hard to know because you wouldn't be able to speak to that person directly to find out what exactly occurred in that situation.
Fairly quickly, too. You get sick, and a few days later, you could pass away, particularly if you had an underlying health condition. So if there are numbers, if 28 is right, we've had 312 deaths, and the vast majority, almost all of them, most of all of them have been either in a hospital or in a nursing home.
Well, and as with any disease, we have to battle stigma also. It is okay to get a test. You should get a test. If you have symptoms or you have suspected exposure to someone, please get a test. And the earlier we can find out and take care of somebody who has COVID-19, the much better off they will be, and the much better off their family and friends will be. So it is okay. And we certainly don't want to shame people and blame people for getting COVID, or perhaps even engaging in behavior that we know is probably risky. We don't want them to do that. But if you did that and you got COVID, please get help, get tested, and let's take care of it and make sure it doesn't spread any further.
Thank you.